Oftentimes you may not know you need a revision surgery and you just show up with vague pain in your hip or knee again, and you're wondering why you have it because your knee or hip has been good for a long time. The hip gives you a little more signal sometimes than the knee. Often you might present with pain in your groin crease area or pain in your thigh, in particular when you first start doing activities. Like if you're seated and you first get up, those first 10 steps you might be really painful and then it smooths out and you feel better. Or for instance, first 10 steps in the morning you really are sore, or doing stairs. And so oftentimes people don't even really realize there's a problem with their hip or knee replacement. They just know something's different than it's been in the past. And part of that, we also encourage people who have knee and hip replacements to get things looked at every 5 to 10 years with an x-ray or a check-in with an orthopedic surgeon, because some things we can see on x-ray that you don't even know anything's wrong. You don't have pain, you don't have symptoms. So it's really mostly about people having pain, or sometimes it's not pain. Sometimes it's swelling of the joint in the case of the knee, or feelings of instability of the knee, where before the knee felt pretty good, now it's starting to feel loose and you're noticing it swelling every time you're active, or pain with weight-bearing activities, particularly the longer you're on it, the worse it gets. So there's a whole host of symptoms that can sometimes be tracked back to the knee. I think most commonly people think it's muscles around the knee and they kind of write it off and don't seek help for a long time. So sometimes it's easier just to get in and see somebody just to make sure that, hey, everything's okay with that knee or hip replacement. It usually sets your mind at ease and we can tell you, yeah, it's nothing big that I see. So when you're talking about revision surgery of a knee or hip replacement, it's usually a very different experience. And sometimes that experience can be easier, but often it's more difficult because it's a second time around, or sometimes a third or a fourth or a fifth time around. And so there's just different variables. It's often a slightly longer surgery. There's often things that are different that we have to deal with, like bone loss or getting the old pieces out of the joint that require a lot more work. And so it's usually typically a longer surgery. It can be up to double the length in time. That also sometimes means we have to do some restrictions after surgery we don't normally do in first-time surgery. We might limit the amount you can walk on it or the amount of weight you can put on it, or we might limit how much you bend the knee, or we might put you in some type of brace. So there's a little bit of a different aspect to revision surgery, and you never know quite what you're going to get into until you're there. The second part of revisions is they have more complications. For instance, there's a higher rate of infection. There's a higher rate of folks having some continued pain, or in the case of a hip replacement, there's a higher rate of complications such as dislocation. And so it's just more involved and it needs to be carefully done. In addition, sometimes it can be easier. For instance, if the plastic just wears out on a hip or knee replacement and you just need to replace that, you're not doing any bone work, so there can be actually less pain and you can be moving quicker and faster than you did with your original surgery. And so there's that aspect of it too, and it's just so variable. There's such a large spectrum for redo surgery. The outcomes of revision surgery are a little bit less in comparison to first-time surgery. For instance, with first-time surgery, 85% of people like their knee replacement. With revision surgery, that probably drops down to 70-75%. So there is more variability in how people turn out. And along with that, I would say the recovery time can be a little bit longer, but most of the time it's a similar recovery time frame to their first surgery. Now, if we put some restrictions on you, that may drag out longer, so it's more variable in the recovery time than first-time surgery. Hip replacement, first time around, 95% successful. Revision surgery is still very good, about 80% successful, but again, there's that drop-off from the first time to the second time. And that's not every revision. Again, remember, there's a wide variability in what revision surgery means. But with the hip replacement, again, in general, you're going to recover about the same pace. If you just have an easy revision where your plastic is exchanged, might be quicker. If you have to redo everything in the hip replacement, It might be longer, somewhere on the order of 3 months. So that's just a general guideline. So therapy after hip or knee revision surgery is really important, just like it is the first time around. But because the surgeries are often more involved, or we may put some restrictions on you after surgery, you really need to adhere to whatever your surgeon tells you for your rehabilitation. A lot of this can be done on your own, and in fact, the vast majority of it is your responsibility, and you get out of it what you put into it. But if you don't follow instructions or don't do the therapy, you may have more pain, it may take you longer to recover, and you may end up with a result that you're not super satisfied with. In particular for knee revision surgery, you got to get that bending of the knee, and you got to be able to get that knee flat in order for it to function well. So it's really a critical piece of your recovery from any type of revision surgery. There's a whole host of ways to make that happen. I think often the best way to first get into the system is talk to your primary care provider, whoever that provider is, and say, I've had a knee or hip replacement in the past and now I'm experiencing pain. What should I do about this? And oftentimes they might do some simple exam things or maybe even get the x-ray. Sometimes they might call us and ask us to look at the x-ray. And then from there, they can often get you plugged right in to see us. Now, we also run some specialized clinics, myself and my partner, Dr. Conrad, that are specifically for people with painful total joints. So we're also happy to see you, but sometimes it's just easier to get in and see your primary care doctor just to get the ball rolling. And sometimes they might determine, oh no, this is just muscular and you don't need to do anything further, and then you're done. So either way is perfectly fine, but I think sometimes it's easier with your primary provider. But we're also happy to see you, and we have clinics specifically for that because the discussion is often longer and more in depth than, say, for arthritis the first time around.